Hello, welcome to Incorporating Child Abuse and Neglect Prevention into Our Work. My name is Gwendolyn Downing. I go by Gwen, and just want to give you a little bit of background. The original deck and associated handout were developed to support myself and some colleagues working in and with the mental health field and having a collegial discussion and time of personal processing and planning. So for this video and any associated handout and materials, the process is both for your personal use, but also I do encourage it if you want to use it for a collegial discussion. And there is a handout that is linked in the description, and the handout is 27 pages. So it definitely has much more information than what I'll be covering. And if you are using it collegially, it has some options in that for that type of use. All right, and then some disclaimers. The video and the associated handouts materials are provided for informational purposes only, and inclusion does not indicate endorsement of any information nor any sources. And as part of that, as recognized, information is what it is and may be constantly evolving. Okay, so there are three main areas I'm going to go over. First, I'll review the areas of prevention and prompt you to think about the role of mental health in each area. Then I'll go over a 6-column planning matrix. And then I have 2 slides of random ideas. Okay. And before I get started, I do want to give you, if you need it, a self-care reminder or prompt. Please practice any self-care you need to during this video or just at any time, practice whatever self-care you need to. And in your handout on page 5, there is a link to helplines and links, apps and approaches, a PDF of that. There is an appendix B that has sources for self-care and secondary traumatic stress. And within that appendix, there's a subsection that has recommended strategies to mitigate STS from an NCTSN curriculum. And then there's a section on apps and approaches. So just know that that information is in your handout for you to refer to. All right, so let's get into our prevention areas. And it is split into 2 sections, tiers and levels. I'm going to give an overview of both and then give some prompts for the mental health focus. So, starting with primordial, the focus is for the entire population and society, and the goal is to prevent development of risk factors. Then we have primary, and the focus is on the entire community regardless of risk. And the goal is to reduce vulnerabilities and exposure and increase protection and buffering. Then we have secondary, and the focus is on families or individuals with 1 or more risk factors. And the goal here is prevention and, should anything start to occur, that early level detection and intervention. Then we have tertiary, and our focus is on families or individuals with strong indicators or where care or maltreatment has already occurred. And the goal here is prevention of recurrence. And then I have seen where people add in restorative justice here. So the goal can also include opportunities for restorative justice. And then finally, we have quaternary, and the focus is on providers. And the goal is prevention of injury by the provider or system. And this one can have a really narrow definition of what that means. But for me, and I'm just going to talk about for me, so you can go through whichever definitions you want to for yourself or if you're discussing this. I try to think of it from my view of the trauma-informed approach. And that is, I want to recognize and respond to the impact of trauma and do my best to eliminate and mitigate sources of trauma, including myself. So I kind of take a broader view in the quaternary on really how am I making sure that I'm giving best efforts to prevent any type of re-exposure, re-triggering, but also not doing any additional harm, right? So that's quaternary. So those are our tiers. And I should have started by saying I was going over tiers. I apologize. So then our levels are societal, community, and individual. And those three levels are for each tier. I know it might be, if you aren't familiar with these, it might be easy to think, well, societal's primordial, community's primary, individual's secondary, and on. Um, However, what we really want to think about is for each one of these where we're focusing our efforts. So even in primordial and primary, am I working with each, which level am I working with? And what's my focus? Okay. So then, where is mental health in this? And this could be a very long discussion, and that is not what the focus of this video is. It's just to give some prompts. So a lot of times, not always, but a lot of times when people think of mental health in here, they automatically go to tertiary and quaternary. And there's some logic in that, right? This is where a lot of the work is being done by mental health professionals. However, that's not where all of it's being done. And my personal challenge is, if your focus has been in tertiary and quaternary, is to have at least one goal in primordial, primary, secondary. But I also want to point out that the mental health field has a role in these already. When I was putting this together, I did some reading on the history of the mental health field and helping develop these areas and give leadership and insight into them. So, but outside of that, what are our actual actions we're taking to help implement them? Okay, so that is the overview of the prevention areas. So then we're going to look at our planning matrix. And for our planning matrix, I'm going to go through it um, left to right. However, you could start at any point and then work through the different areas. Okay. So the first thing is going through the aspect of your role or roles. I know people sometimes may have multiple pay positions, they may have a pay position and some volunteer positions. So just looking at your role or roles, and then what are all the different parts of that? Do you provide direct services? If you do, is it in office, in homes or locations? Is it virtual? Do you give trainings or presentations? What groups or meetings are you a part of? What's your own personal and professional growth plan? What materials do you give out? And so on. Then looking at the prevention tier, am I going to work on primary? Am I working on quaternary? What am I working on? And then with that tier, what level am I working on? Individual, community, or societal? And what's my focus? Am I focusing on raising awareness? Am I taking steps to do advocacy? Am I taking actions? And some different options to consider. Doing something completely new. Doing something a little that you're already doing, but maybe doing it a little differently. Um, Again, doing something you're already doing and works, you're like, oh, but I need to do a little bit more of that. Trying something again. Sometimes we've tried something and it did not go well. However, when we look at things, we figured out which factors that were impacting it and not going well. And so this may be a good time to try it again if you kind of look at those, if those factors have changed. All right. And then planning, I have planning in two categories. The first one is listing things I will do or try to do, right? I'll at least we'll try it and see if it works. And so in that list, as I'm listing those things, having what I'll need to do them, when I'll do them, maybe setting calendar goals like monthly or quarterly. And some of them may be things I want to do PDSAs on. Um, Plan, do, study, and act, if you aren't familiar with the acronym. And then the second list under planning are things to learn more about. And so it might be, I think this is a good idea, or I've heard about this, and I don't want to lose track of it. So I'm going to make a list of that. And with that, then look into where or who you can access to learn more and when you'll do it. So that is the planning matrix. And then we have, I have my 2 slides of random ideas. So the first one is to become a no-hit zone. And if you aren't familiar with no-hit zones, um, please look at the information, the link to the information in your handout. And I know the individuals involved in that effort are going to be more than happy to help you. And if you're like, well, Gwen, I am a no-hit zone. Um, why do I need the no-hit zone? That is a whole presentation, and I would not do it justice, but it can be very beneficial. So I encourage you to check it out. All right. So then materials. On materials, maybe it's ordering and printing prevention handouts. Maybe it's putting up posters with prevention options. Maybe adding a resource section in your non-prevention training materials. So, like, for example, this is on my list to work on. I normally always, regardless of topic, have a self-care section in my handouts. And so I was like, it would not be that big a deal to add a small section on prevention in every handout I do. So that's on my working list. Then on materials, maybe you already have some materials out, but maybe putting on your calendar, rotating them out. So maybe one month is keeping children safe online, another month is teen dating violence. And then, like in resource or referral list, including something. So that's materials. Then virtually. And obviously, I'm not speaking about if you're working virtually with a client, but if you're in meetings or other events, and you have a background, having like a small pinwheel or a no-hit zone emblem if you get certified as a no-hit zone, but having something small in your background to to support child abuse and neglect prevention. Sorry, my brain had a skip there. Part of my skip was, Gwen, they're going to say there's nothing on your background. And that is true because I haven't gotten to this part yet. As you're putting ideas together, you're like, I need to work on that and I'll get to it. All right. Okay. So then getting CAN prevention training or more CAN prevention training. So maybe it's you taking a new course you haven't taken before or going back to one. Post or sharing free training opportunities. And if you're working with clients, maybe getting a sponsorship for clients to attend ones that have a cost. Listening to podcasts. And I did look, and the National Center for Community-Based Child Abuse Prevention has a podcast. And then NCAN listed 2 different podcasts on their website. All right, following or joining. So following groups on social media. So maybe following your local CAN prevention office, or I said local, your state. You may have a local, but normally it'd probably be your state prevention office, or nationally, like the National Child Abuse America, Prevent Child Abuse America. Sorry, I fumbled that one. I thank you for understanding. All right. Then signing up for listservs, and there's one I included in the handout as an example, which is abuseresearch.info. And then joining a group, local or national. So what are groups that are already doing this that you could join and be a part of? And on the national level, I will give a shout out to APSAC, which is the American Professional Society on the Abuse of Children. All right. So then advocacy. Setting a time to do some kind of advocacy. And if you normally advocate, look at where you're advocating. Are you advocating at the national, state, or local level? And maybe picking another areas to support or adding in an extra advocacy effort. And then also in advocacy, if we're advocating for access to mental health and substance abuse services prior to child abuse and neglect, that can help reduce the factors for child abuse and neglect. So that's definitely a place we can advocate. In groups or meetings, sharing a handout or resource or opportunity, even if it's just at the end. So if I'm doing something virtually, doing a quick drop-in chat, or maybe having something that can be picked up on the way out the door. Obviously, if I'm in person, should have said that. And then clinical areas to consider. Where are we in our trauma-informed approach efforts? And going through our intake, screening and assessments, diagnosing, treatment, and documentation. So those are just some random ideas. And with that, I'm closing this out. And obviously, I am not going to be asking you questions, comments, takeaways, and next steps. But if you are using this video in any collegial way, I thought it'd be nice to leave those prompts up there. But for now, thank you very much. I do hope this is of benefit. And please reach out if you'd like to. Take care.